So for my second case presentation, we scanned an OB with possible acrania. Acrania is also known as exencephaly. It's a lethal anomaly that manifests as absence of the cranial bones with presence of complete, although abnormal, development of the cerebral hemispheres. Acrania occurs at the beginning of the 4th gestational week when the mesenchymal tissue fails to migrate and cranium does not form properly. It's classified as a neural tube formation defect. Unfortunately, acrania has a very poor prognosis and usually develops into anencephaly. Exposure of the brain to amniotic fluid results in breakdown of the brain tissue. It occurs in 1 in 1,000 pregnancies and cannot be officially diagnosed until 11 weeks. The prognosis varies. It is considered a fatal condition. Some babies may live a few hours after birth, but the mortality rate is almost 100%. So sonographic findings of acrania, you'll have the presence of brain tissue without presence of the calvarium. So you'll see not well-defined brain tissue floating in the amniotic fluid without the echogenic skull cap that we're used to seeing. Disorganization of brain tissue, prominent sucal markings. It's also associated with other abnormalities and anomalies such as spinal defects, cleft lip and palate, talipes, cardiac defects, omphalocele, and amniotic band syndrome. So when we're examining a patient with possible acrania, it's a good idea to keep these other defects in mind to be on the lookout for. Labs associated with acrania, just like any other open defect like anencephaly or omphalocele or gastroschisis, pregnancies that involve an open defect such as these will have an increased levels of alpha fetal protein. So patient history, a 23-year-old female, this was her first pregnancy. She denies smoking and drinking. Her only complaints were morning sickness, nausea, and vomiting. The equipment we used for the ultrasound was a GE Voluson S10 and of course the curvilinear transducer. We also used the 3D setting on this machine, which I'll show a picture of in a minute. So crown rump length measures 8 weeks and 4 days, which lined up pretty well with her last menstrual cycle. The gestational sac and yolk sac appeared within normal limits. Her gestational sac was in the top of her fundus. It didn't appear small or large. Arms and leg buds are present. Head shape appears slightly abnormal. This is just an M-mode sample of the heart rate, which was also normal. This was the 3D image, and here you can see the projection of abnormal brain tissue with the absence of the skull. So the physician's report, like I said earlier in the video, you can't definitively diagnose acrania until 11 weeks. So possible acrania. They're Drew Labs after her ultrasound, and then we'll do another follow-up ultrasound at her 12-week appointment. The cranium usually ossifies around 11 weeks, so that'll help us get a more definitive view. And she just was informed to call the office if she had any more problems or concerns.